Now to the coronavirus pandemic. Average daily deaths in the U.S. have fallen below 300 for the first time since the spring of 2020. Daily infections are also continuing to fall, with the 7-day average now below 12,000. But the progress comes with a warning from health experts who say we could see those numbers spike if vaccinations don't increase. Manuel Bojorquez has the latest from Miami.
Tonight, the nation remains divided over vaccines. 65% of U.S. adults have gotten at least one dose. Several states in the Northeast, as well as Hawaii, have far exceeded that and seen infection rates tumble. But 4 states, mainly in the South, rank at the bottom, with new cases already rising in 2 of them as the more contagious Delta variant starts to gain hold.
I think they need to work harder reaching across the aisle and courting conservative champions to get populations vaccinated, especially in the South this summer. Otherwise, we're going to see that surge.
For Dr. Peter Hotez and others on the front lines of public health, like Dr. Anthony Fauci, the newest threat is to their personal safety. They've received death threats from those who feel it's government overreach.
It's a scary time for a number of us targeting American scientists.
I mean, this is impacting your life.
No, I mean, no one likes waking up to email that say an army of patriots is going to hunt me down.
The latest sticking point is requiring proof of vaccination. It's what got fans into this Foo Fighters concert last night, the first full-capacity event at New York City's Madison Square Garden since the pandemic began. But several conservative states have banned so-called vaccine passports, citing civil liberties and economic freedom.
When people feel like some of those rights are being taken away, they naturally push back against that.
In Florida, Governor Ron DeSantis won one round against the CDC. A judge ruled the agency's vaccine requirements for cruise ships cannot be enforced. The CDC had wanted 95% of passengers to be fully vaccinated. For now, cruise lines are coming up with their own rules. This weekend, the celebrity ship The Edge is scheduled to become the first passenger cruise ship to set sail from Florida in 15 months, with more than 95% of passengers and 100% of the crew fully vaccinated. Elaine?
Manuel Bojorquez, thank you. For more, let's bring in Dr. Amesh Adalja. He's an infectious disease expert and a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Dr. Adalja, welcome. The former head of the FDA says the U.S. may need a, quote, different vaccine delivery strategy as the vaccination rate lags. Do you agree, and what might that look like?
I do agree. What we're seeing now is that we're hitting a wall, that people who wanted to get vaccinated largely have been vaccinated, and now it's a lot harder to get each additional dose into a person's arm. So what I think we need to do is make this more convenient, make it more easy, make it something that people can do wherever they are without having to make kind of appointments. It just has to meet people where they are, including door to door. We have to kind of remove any obstacle that a person can have. And I also think that when these vaccines get full FDA approval, you'll remove one talking point from the vaccine hesitancy crowd, and you'll start to see more businesses be comfortable requiring that amongst employees. So I do think we're going to get higher rates, but it's going to be very difficult to do so.
Well, the World Health Organization has a really sobering warning, saying the Delta variant will, quote, pick off vulnerable people, such as in places with low vaccination rates. Officials say it has the potential to be deadlier. What kind of a threat does this pose to communities that actually are far enough along in their vaccination efforts?
So if you're fully vaccinated, the Delta variant really poses no risk to you. What we worry about in the United States is that there are many counties, many states where the vaccination rate is low, and you're going to see the Delta variant just by simple biology, because it's more contagious, be able to take off and cause infection. And some of those individuals are going to get hospitalized. We'll see hospitalizations tick up. And it's going to be more of an individual threat than it is going to be a systemic threat, because so many high-risk people have been vaccinated, those above the age of 65. So really getting the vaccine is going to improve your life in terms of preventing you from getting the Delta variant, getting hospitalized to the Delta variant, or spreading the Delta variant among your unvaccinated friends and family members. That's the issue that we face. And I think it's completely fixable, because all we have to do is get more vaccine into people's arms. And then the Delta variant really is not a threat at all to the United States.
Well, the World Health Organization official says there is a short window of time to get vulnerable people vaccinated globally, and says, quote, we haven't done it. So who makes up these vulnerable populations, and when does that window close exactly?
So We know that the Delta variant is much more contagious than other variants, as well as a natural form of this virus. So the quicker we can get vaccine into people's arms, the better it is. I don't know that there's any way to actually put a parameter on when that window opens and closes. The quicker we do it, the better it is. And this is especially important for countries where their high-risk populations have not been fully vaccinated. We saw what the Delta variant did in India, where hospitals ran out of oxygen. That's going to be repeated in other countries where their elderly population, their nursing home populations are not vaccinated. So the quicker we take this seriously, the quicker we get vaccine into the arms of the world's citizens, the better off we're going to be. And I think that this Delta variant is going to be a major challenge.
Well, a CDC advisory committee will be meeting later this week to discuss heart inflammation after vaccination, booster shots, and more. So what are you hoping will come from this meeting?
I want to see a lot more data on the myocarditis risk. So that's the inflammation of the heart that we're hearing about happening in boys between the ages of maybe 16 and 24 that have gotten their second dose of the mRNA vaccines. I would like to see that risk-benefit calculation made explicit to understand how common this is occurring, how linked is it to the vaccine, and what are the options? Do we space doses more in those individuals, or do we go with one dose only in some of those individuals? There's a lot of things on the table there. When it comes to boosters, I think most of us believe that in the short term, we're not going to need boosters, but I'd like to see the criteria put forth for what's going to determine whether or not we need boosters. And to me, it has to be fully vaccinated people getting breakthrough infections that land them in the hospital, which I don't think are going to happen for several years from now.
Well, a new study published in the journal JAMA Internal Medicine identified a quick decline in other respiratory viruses aside from the flu during the pandemic. Doctor, what might this mean for next winter if the U.S. and other nations continue on a path towards reopening more fully?
Those other respiratory viruses didn't disappear, and we have to anticipate that they're going to be back, and they are already coming back. I've already taken care of multiple patients with other respiratory viruses than COVID. They went down because of social distancing and because of masking, but they're going to come back. And there is some theoretical concern that they might be more severe because our immune systems have kind of been spared from them for a year. So we have to be on alert for them. Already the CDC has issued a report about RSV in the South, which is a respiratory virus that affects young children. So I think this is going to be something we're going to have to watch and see. The best way to prevent this happening is to get flu vaccines in people when it becomes time, and to really be vigilant when you're sick or when you're in crowded and congregated places.
All right, vigilance is key. Dr. Amesh Adalja. Dr. Adalja, thank you very much.
Thank you.